Happy morning, dear students. Today's topic is anorectal malformations. Here, anorectal malformations. These are the congenital malformations. Okay, we will see what is the introduction of what is anorectal malformation. Here, the anorectal malformations are birth defects or problems that happen as an unborn baby is developing during pregnancy. With these defects, the anus and rectum does not develop properly. They are the lower part of the digestive tract. So, because of undevelopmental process, what happened? The anus and then rectum was not developed properly. Here, what is the mean of ano? Ano means anus. This is the opening at the end of the large intestine. Okay, so through that the stools is passing. Okay, however, there is a bowel movements also is there, that is called as anus. Okay, and next one is rectum. Rectal means here it is called as rectum. This is a part of the large intestine just above the anus. Okay, here external part it is called as rectum, above that part is called as anus. So here what happened in this condition? Anorectal malformation. Here the anus and then rectum both are not formed properly because it is a congenital malformation. Okay, so the lower part of the digestive tract was not developed properly. Okay, and with an anorectal malformation, several problems can be occur. What are the problems? That is, the anal passage may be narrowed. Sometimes the anal passage, it is very narrowed. The anal opening may be covered with the tissue or membranes. Sometimes whenever we are dilating, that time it will be the tissues and then membranes will be separate, and then baby may pass the motion or meconium. Okay, that also one of the condition. And next condition is the rectum may not connect the anus. Sometimes the rectum, here the opening part, outside part, may not connect to the anus. So what happen? It is connected to the another part, means it connected to the urethra or vagina. Through that it may be passing, but we can't recognize. The baby is immediate after birth, what we are telling that okay, meconium is passing, means from where it is comes we doesn't know, but baby is passing meconium. These are the conditions lately recognized. Okay, and next condition is the rectum may connect to the part of the urinary tract or the reproductive system. This happens through a passage called as fistula. Here the fistula means it is an opening between the two organs. There is a connection between the two organs will be there. So what happen here? The blind end will be there, but the mucus, the anus is connected with the another part, that is connected with the reproductive system or urinary tract. So baby is passing meconium, but somewhere else it. Okay, and next one is anorectal malformations causes problems with how child has bowel movements. For example, the treatment depending upon which type of the problem of that baby is having. Okay, which type means if it is anal passage may narrow, means you should dilate that. The anal opening may be covered with the tissues or membranes, means they are removing the tissues and then membranes. The rectum may not connect to the anus, means that time the surgical intervention is needed. Okay, the rectum may connect with the connect to the part of the urinary tract or reproductive system, means that time you should decide that that is a fistula. You should repair for that. Okay, depending upon the condition, the surgical intervention and treatment is based. Okay, and next, what are the causes for this anorectal malformations? As an unborn baby is growing in its mother's womb or uterus, different organ systems are developing and maturing. The lower end of the intestinal tract forms fairly early in the pregnancy. Okay, here the lower intestinal part is formed in early pregnancy only. In an unborn baby, the lower part of the large intestines and urinary tract starts off as one large mass of the cell. Okay, it is starting to develop like that, one large mass of the cell. Okay, and a certain steps must happen in the first 3 months of pregnancy or gestation. What are the steps is comes here means these steps are needed for the rectum and anus to break away from the urinary tract and forms promptly. Okay, first of all, both are connecting together. After that only it will be separate. Sometimes these steps does not happen as they should. Then the rectum or anus may not develop normally. In most cases it is not known what cause this is to happen. Okay, but in early pregnancy it was not developed properly, so here the anomalies will be there because of some deformity. Okay, so this is called as and these are the causes of anorectal anomalies. Okay, coming to the symptoms, anorectal malformations cause problems with how a child has bowel movement. Most anorectal malformations are found before a newborn itself. Okay, and leaves the hospitals. Before itself, they are recognizing whether there is no opening of the anus. They will recognize. In the if problem is not found in the hospital, the symptoms may be include. By hospital itself they are recognizing that baby is having some anomaly. So if they are not recognized, what are the symptoms may be developed means lack of stool and stool coming from the vagina and urine coming from the anus, troubling trouble having a bowel movements or baby is having constipation. These are the symptoms may associated with that baby. Okay, look at this picture. This is the normal image of the baby. Here this is large intestine. Here this is called as rectum. This is called as anus. Then opening part of lower part of the large intestine, it is called as anus. Above that part is called as rectum. Okay, what happened in this anorectal anomalies? Here the rectum, the anus will not be open here properly. This here the anomaly will be there. Sometimes it is connected with the urethra and then connected with the reproductive tract. Some fistulas will be there. Okay, that is about the clinical features of anorectal anomaly babies. And diagnosis. Healthcare providers will do a physical exam when baby is born. The provider will look at the child anus to see if it is open. By physical examination itself, they are recognizing immediate after birth. A child may also have imaging tests such as abdominal x-rays, abdominal ultrasound, chest, CT scan, MRI, lower GI or gastrointestinal series also called as barium enema should be done. Okay, and upper GA or gastrointestinal series also called barium swallowing. These are the studies. Diagnostic evaluations should be done for assessing of anorectal malformations. By physical examination itself they are recognized whenever there is a fistula between the anus and then rectum and reproductive tract or urethra. That time some fistulas is there, no, they has to rule out for that assessing where the fistula will be there, and then so for that they has to do the CT, MRI and then abdominal ultrasounds. Okay, those are the diagnostic evaluations. And coming to the treatment will depending on child symptoms, age and general health. Here the child's conditions and clinical features, according to that child's age also is needed. Okay, but because newborn is there, no, because they are born prematurely or sometimes they are having low birth weight, so the general condition of the baby also is needed for the surgical intervention. It will also depend on how severe condition is. Most babies with anorectal malformations will need to have surgery to correct the problem. The surgical intervention is must and should for this anorectal malformation. The type and number of surgeries child need will vary. It depending on the type of the problem of child has, the problems include the following. First one is a narrow anal passage. For that, what are the surgical techniques they are doing means, here the surgery may not be needed for this narrow anal passage, but they are doing one procedure. That procedure is known as anal dilatation, may be done from the time to time. This helps to stretch in the anal muscles to stools can pass through. By using of dilators, they stretch in the anal muscle. They insert the dilators into the anus and then rectum. They stretch in the anal muscles, and then automatically that fecal matter, that meconium will be comes outside. When here the condition itself, narrow anal passage. Narrow means it is a small opening, so they are dilating further. The surgical intervention is not needed for this condition. Okay, next one is anal membranes. I said no types of the anorectal malformations. Here the anal membranes, the membranes or tissues is obstructed in that anus, so the surgery is done to remove the membranes. Anal dilatations may need to be done to help with any narrowing of the anal passage. So here the surgical intervention is needed to removal of that membranes. Okay, coming to the next condition, that is lack of rectal or anal connection with or without fistula. That time the surgical intervention, here the series of surgeries is done to repair the problem. These surgeries including, what are the conditions, what are the surgeries should be done for this anorectal malformation is, that is colostomy. Okay, colostomy. Ostomy means to opening of the colon, because here the anus is closed. It is connected with the another part. So it may be infect with that another part. So you should prevent that. So you will do the surgical intervention of this anorectal malformation is colostomy. Colostomy. Colostomy means ostomy means to open the colon. Here with a colostomy, a large intestine is divided into two sections. Okay, here they are divided into two sections. The end of the intestines are brought to the opening in the stomach. Okay, here they are open in the stomach here. Okay, and the upper section, let's stool passes through the opening, that is stoma, and into a collection bag. Here the collection bag is there, whatever the fecal matter is collected in this bag. Okay, and the lower section lets mucus made by the intestines pass into the collection bag. A colostomy does not damage the child's digestion. Okay, here it won't damage the child's digestion. This is colostomy, how they are doing for surgical intervention of anorectal malformations. Your child can also grow before the next surgery. Okay, here the series of surgeries will be there. Okay, first upper and then they are doing the lower. Okay, they are diverting the fecal matter into the upper part. They are opening the stomach and then open the colon, and they can put the bag, whatever the fecal matter is collected in that. When the baby is grown up, baby is gain the weight, baby is adequate, so they are doing the next surgeries. And when the next surgery is done on the lower section, the of the intestine, there won't be any stool there in there to infect the area. So everything will be removed, the stools will be removed. The nursing staff and other healthcare professionals that work with your child surgeon can help you learn to take care of the colostomy. The local and national support groups may also be helpful for this colostomy conditions. Okay, what happened here, the first they are open the colon, and then they put one bag, and whatever the fecal matter is collected in that. Okay, when after that, when the baby is grown up, baby weight is gained, baby age is good, baby is not having any infective conditions, then they are open the anus, whatever the tissues or whatever the fistulas will be there, they are removing that connections, and then they will do the surgery. Okay, okay, this is about the surgical intervention of anorectal anomalies, that is colostomy. Surgical intervention is okay. This is the colostomy area, and then colostomy bag. Mostly colostomy is done on the left side of the baby. Okay, because of for doing of the surgical intervention, baby is any no problem is not there for any infections. Okay, I hope everybody is understand.